All right, so good morning. My name is Daisy Ortega. I'm the director of the Community Health Training Institute, and we're really excited to start the year off with this wonderful webinar, Effectively Engaging Multi-Sector Partners. And here we have the wonderful Steve Radini, who will get us started today on this wonderful Monday morning. And if you are in the Boston or East Coast area, we do have wonderful weather here today. So thank you all for finding time in your Monday morning to get started with us here. So as you can tell, this will be an hour-and-a-half webinar. And we also have capabilities for you all to send us a text message or an email. And then also if you're on Twitter, if you want to use our hashtag MA Coalitions, we'd love to have you do that so that we can hear what your questions are or comments are about the presentation. So we'll get right along. All right. So just a heads up about what's coming up for us in the Training Institute. On October 8th, we have another webinar that's titled, What is Public Health and How Does it Impact All Other Sectors? So we encourage you all to sign up for that if you have not already. On October 29th, we have a coalition quality improvement. And again, if you want more details on the content of this webinar, you're more than welcome to check out our website, hrainstitute.org. And then November 19th, we have 2 in-person trainings. One in the morning that will be led by me, Daisy Ortega, Building Coalition Capacity and Infrastructure. And then one in the afternoon called Sustainability and Resource Planning. And then on December 3rd, we have another webinar, Environmental Strategies and Policy Development. Now again, this is not an exhaustive list, but just a few to get us started on the year. And of course, you can always check out our website to get more information. So just a couple things, a how-to, even though some of you may be familiar with webinars, but you're more than welcome to ask questions during the webinars by typing into the questions box, which is on the right side of your screen, or it depends on where you docked your little doohickey there for the webinar. You can also use the chat box. Sometimes you can see the chat box, sometimes you only see the question box. Whichever box you can type into, just go ahead and do that, and then we'll make sure we capture your questions and comments. So again, we'll try to address your questions along the way, so don't be shy. Anything that comes to your mind, please share it. And then at the end of the webinar, it will be very awesome if you all could fill out the survey that we'll send out to you all. We'd love to hear your feedback and thoughts, not just on the content, but the delivery. And then we will also follow up with a link to the slides and the recording to this webinar as well. So again, we encourage you to use hashtag MA Coalitions to tweet questions or comments at HRA Institute during or after the webinar. So again, there goes that question box. It may look like that. And you're either listening to us through your computer or the telephone, but I believe you're all on the computer. And then we will get started. I'll have Steve introduce himself.
Good morning, folks. This is Steve Radini from Health Resources in Action, and I look forward to working with you today to talk about effectively engaging multi-sector partners. So the first question I have for you is I'd like you to think for a second about
Awesome. Any others? All right, so we hear from Melissa that some coalitions are very nonprofit or service provider heavy. Okay. Any other challenges or bumps in the road? Determining the size of coalitions and attendance. Really good question and challenge. Desire to remain autonomous and not give up any authority or control. Okay. And then Melissa again with what's in it for the business community to be involved. So really finding out the motives of stakeholders such as businesses. Competitiveness, whose issues are most important, whose meeting is most important.
Thinking about nonprofit and service provider kind of balance there, and thinking about other stakeholders such as the community to engage in the process, thinking about attendance and autonomy, and thinking about engaging businesses in this work. So what I'd like to do is take you through a few sets of slides and then work with Daisy to kind of have a conversation, and then really, as much as we can on a webinar, allow you all to ask questions as we go through this set of slides and this conversation about engaging multi-sector partners. So if we go to the next slide, I just wanted to put up there 3 definitions that we look at as we think about multi-sector partnerships. One is community, another one is engagement, and another one is partnership. So what I'd like to do is, in the first area, when we think about community, these are definitions I've been using for the last 20 years or so in terms of the work that I've been doing and that we use in this organization. So when you think about these, community exists when people who are interdependent struggle with the traditions that bind them and the interests that separate them so they can realize a future that is an improvement on the present. And I'm going to just let that sit for a minute in terms of allowing you the chance to think about some of the concepts of the words as you think about community there. I'm not suggesting that that is the only definition of community. That just happens to be an overarching definition that we use as we think about this work. When we think about engagement, we think about a process that about working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those individuals. And that comes from the U.S. Centers for Disease Control and Prevention in a piece that they put out that we're happy to share with you on community engagement. And then finally, as someone asked about a definition of partnership, we think of partnership very broadly as a type of organization in which 2 or more individuals or agencies pool together money, skills, and other types of resources and share profit and loss in accordance with terms of the partnership agreement. And so when we think about profit and loss there, profit and loss may be monetary. It may be something else that is non-monetary in terms of programmatic or other types of things. So you can think about partnership very broadly here as you think about your work. So I hope that helps answer a little bit of the definitions as we think about moving forward. What I'd like to do is move to the next slide and share with you kind of some of the thinking behind why you would even look at multi-sector partners. And this goes to kind of Arthur's question about thinking about different missions and motivations. And I guess what we would argue is that it's completely appropriate for agencies and providers that are coming together to have different missions and different strategic directions as individual agencies. However, if you're coming together under a partnership, you really need to be thinking about, so where is that overlap or where is that shared purpose among those different agencies and entities? And that's where a shared vision or a shared purpose comes, has a relevance and an importance. And if you, the research will tell us, but also our practice has told us, is that if you're bringing together a multi-sector partnership and you really haven't figured out what a common vision is, there's not a likelihood, there's a greater likelihood that that group will not survive over time because they will be a pull based on the various missions and desires of those entities. So even though we find that there's not a lot of funding to help think about vision, there are not a lot of resources, and in fact some funders may not even put a lot of importance in thinking about vision. What the literature tells us and what our practice tells us is vision is very important. And as we think about building multi-sector partners, it's important to respect the mission and directions of each of our partners, and at the same time we need to come together to think about what brings us together in terms of a common purpose and our core values. So in many of the coalitions that we work across the country, I wanted to just put out an example of a vision that we typically see in terms of a healthy communities for all. I won't go through all these areas, but typically what we find in terms of working with groups that are working on particular topics such as asthma or substance abuse or tobacco, or geographic groups or population groups that we work with, they typically take a step back to think about what is the vision that's bringing them all together. And some of the key things that we find is that when you're bringing multi-sector partners together, you need to think about a broad definition of health and community. And so health, we need to think about health more from a social determinants of health lens in terms of not just a topical health area, but from an economic point of view, from a transportation point of view, an education point of view, all of those things that impact health. And I'll speak about that in a minute. And then as we begin to think about this vision, we also think about who is providing this vision. Is it just providers? Is it just the nonprofits? Have we engaged the business community? Have we engaged politicians? Have we engaged young people? Have we engaged adults? Have we engaged elders? Have we engaged the community members that we're interested in working with in this process? And quite honestly, sometimes what I find is we come together as providers and we forget to engage the very populations we're interested in working with. So it is very important for us to think about from the very beginning who we want to engage in this process. And in a minute, I'll take you through a quick exercise to begin thinking about who's at your table and who do you want at your table. And what we'd encourage you to think about is to make sure that you're always asking that question, who else do we need to bring to the table? So if we go to the next slide, and this speaks to kind of the broad definition of health, is that when you look at what the Centers for Disease Control and others have put together, this slide is basically telling us there are numerous factors that influence health status. And when we take a minute to look at this, what we see is a significant number of factors that affect health are related to social and economic factors, such as your education level, your employment status, your income level, your family and social support network, and the community at large. Another factor that weighs heavy on influencing health status are our health behaviors in terms of thinking about, are we physically active? Are we smoking or not smoking? Are we eating healthy? Do we have access to healthy foods? So when we begin to think about access to healthy foods, that also brings in the physical environment. So when we begin to think about factors that influence health status, in addition to the quality of health care we receive and access to that care, if we're fortunate enough to be able to access that care, there are other factors such as social and economic factors, healthy behaviors, and the physical environment that have a profound impact on our health status. So as we think about the work that we do around health and public health, it's important for us to think about the types of individuals and the other sectors we would want to engage from the broader community to help us influence health status. And so the next slide, when we think about this, is back in the 90s and early 2000s, we thought about this work from multiple levels to influence health status. We thought about what we could do to impact or influence the behavior on an individual in terms of knowledge and attitudes and skills. We thought about what we could do to influence the individual through his or her interpersonal relationships with his family, friends, and peer groups. We then began to do work in institutions, and we began to think about what types of rules and regulations and policies and systems were in place in the workplace, in schools, and other institutions in the community that may influence health status. We then began to think about, or also have an opportunity to think about, what goes on in the community in terms of the social networks and norms of a community that either promote health or hinder health, and then related to public policy, both in terms of national, state, and local laws. I'd also say policy with a small p in terms of what are those informal types of laws or systems that are in place within the workplace, within schools, within your own home environment that look at health status, improving health status, or supporting healthy behaviors. And so as we think about this work, when we looked at the slide before in terms of all those sectors we would want to engage in the health status, in this slide we have an opportunity to think about where we're working, whether we're working with individuals, we're working with families, institutions, community, and public policy. And as we've seen our work in public health move over the last 15 to 20 years, we've moved to those outer rings of the circles to address policy and the norms within community. Because one, we know that we'll have a greater impact, and two, there's a greater likelihood that we'll be able to sustain some of the public health changes we'd like to see. And so this next slide is Tom Frieden from the Center for Disease Control and Prevention's Health Impact Pyramid, which takes those circles and kind of looks at them in a triangle, in the same sense that when we think about the areas to impact behavior from the individual to the community, we have an opportunity to look at the work that we're doing as it relates to this impact pyramid. And as we're interested in having a greater impact on population health, we want to focus on the lower rungs of the pyramid and at the community level, where we want to change the context of the community norms, and we want to look at the socioeconomic factors that also influence health status. So when we think about the value of multi-sector partners, and we look at that slide, the previous slide, in terms of the triangle, if we really want to create change at a systemic level and address the issues around socioeconomic issues, we can't do this individually. We can't do this as an individual agency. We really have to come together in terms of multi-sector partners who are interested in addressing newer and broader issues. We're interested in collaborative problem solving and creating culturally relevant solutions to this work. Partnerships minimize the duplication of efforts, and through partnerships we're not only able to find that common vision, we're able to leverage additional resources to do the work that we need to do that hopefully is going to be sustainable over time. So if we go to the next slide, I want you to take a minute, and you don't necessarily have to respond, but this is a slide we use and we're more than happy to share with you to get a sense of, so who are those sectors that you have at your table right now? And to use this wheel to begin filling in who some of those sectors are. So take a second and think about your last coalition meeting or your last partnership meeting, and begin thinking about which sectors those individuals represent. Great. So now what I'd like to do is move to the next slide and show you that same exercise we did in the city of Austin, Texas, where we were working on a project with about 50 stakeholders, both from the provider community and the community at large. And when we did that exercise, these are some of the sectors we began to look at that were around the table. We had faith communities, we had elders and seniors, we had elected officials, we had healthcare, we had immigrant and refugees, we had transportation officials, we had the business community and schools, we had racial and ethnic cultural groups, we had economic development, We had agriculture and food systems and planning and public safety. We had policy and lawmakers. We had young people. We had parks and recreation. So those were the folks that we had at the table that evening in Austin, Texas. In the orange, what's not shown are the folks that they wanted to bring to the table. So there were a whole host of sectors that they were interested in engaging in their multi-sector partnership to move forward. So we began to brainstorm a list of who else we wanted to engage in the process. And the next slide allowed us the opportunity to begin to think about, so who are those organizations and who are those individuals, as we began to think about who those key contacts would be that we wanted to engage. We began to think about, so what type of engagement we wanted from them. Did we want them in a leadership role? Did we want them as a facilitator? Did we want them part of a program committee or a communications group or a resource fund development or a finance group or evaluation? Those were some of the examples that we came up with. I'm sure there are others you can think about in terms of the engagement. The key, though, here is that what we learned is that from the very beginning, we needed to think about who are those sectors that weren't represented. And then we needed to think very clearly about why we wanted to engage them. And we needed to think about, so what the ask was from that individual, both in terms of what skill sets could they offer, and then what type of commitment were we looking for from them. We needed to think about whether they were going to be engaged on a weekly basis, a bi-weekly basis, a quarterly basis, or a yearly basis. And so when we began to think about frequency, we wanted to think about with them how often they might be able to participate. And in a minute, I'll show you an exercise that we have done in terms of thinking about engagement frequency. And so here's a simple case study in Windham County, Vermont, where I actually, maybe a few years ago, took a picture of one of the multi-sector partnerships that resulted in this successful elder housing initiative in a community of over 3,500 people in Townsend, Vermont. So to the left of the building on the left, that large white building, is a 17-bed hospital called Grace Cottage Hospital. That hospital, maybe about 10 years ago, decided they needed to close an adult daycare facility that housed about 20 elders during the day. As a result of that effort or that decision, some of those individuals were going to have to be moved to a facility across the river in New Hampshire, about 20 miles away. So when people began to hear about this, both elders and family members of the individuals who would be affected, they began to organize and began to think about what they needed to do to potentially change that decision. Quickly they realized the decision wasn't going to be changed, but they began to vision and think about what other multi-sector partners they needed to bring to the table to see if there was something else they could do that would allow elders to age in place in Townsend, Vermont. And so quite honestly, the elders that initially came together and the caregivers of those elders really were stuck on this idea of getting the hospital to change their mind. I'm sorry, I said a 17-bed hospital, 17. So thanks if you can't hear me. Please feel free to ask the questions. So with this idea, though, of these individuals, these initial individuals who were interested in kind of getting the hospital to change their mind, what we began to realize is we needed to bring other multi-sector partners to the table to really figure out, was there something else that we could do that would be a win-win. As we began to engage housing officials, as we began to look at what other types of elder housing existed in the state of Vermont, as we began to talk to other funders, as we began to talk to other entities throughout the state and federally, we began to learn that we might be able to leverage some private philanthropic dollars to actually build elder housing within this community. And over the span of 5 years, and through resources we were able to access through private philanthropy and the federal government, and engaging the community, over time, what this group of multi-sector partners was able to do was to form a backbone organization called Valley Cares, which is housed in that brick building in the middle. And in time, they were able to build 90 units of elder housing through resources they access through private dollars and federal dollars, through some models that they learned about in Burlington and other parts of New England. And that housing is market rate housing, it's subsidized housing, and it's assisted living housing. And that house in the middle was actually donated by the farmer who became engaged in the process, who asked if he donated his land and his house, if he could have a unit in that facility when time came. So that land was turned over to him. He ended up moving into the facility before he passed on. And interestingly enough, to the left of that building, which is the hospital, one unintended benefit of all of this work was that we had a group of healthcare providers who actually found it easier to deliver services to this elder population because they were right there next to the hospital, as opposed to having to drive around the county, especially during the winter months, to deliver care. So evidently this is so successful that there are another 30 units of housing that are going up behind that brick house. And that's the result of the work of a group of people coming together, building a multi-sector partnership, formalizing that partnership into a nonprofit backbone organization called Valley Cares, and looking at and engaging other folks and creating a shared vision and purpose that went beyond what their initial intent was. So this is a real success story in terms of some things happening in a rural part of Vermont around elder housing and aging in place. So the next slide I wanted to take you to was, when we think about multi-sector partners, what tends to happen is some of the things you identified in terms of the competition, the different missions. We also find, though, that sometimes when we're doing this work, that just because we've come together as a partnership doesn't necessarily mean we're going to have some level of collective impact. Oftentimes what happens is that our impact can be isolated, or what we may run into are multiple goals and measures, multiple agendas, separate efforts that lack coordination, disconnected action, and then interventions that aren't aligned. So as you think about the work of multi-sector partnerships, we really need to think about this idea of collective action or collective impact. John Kanya and John Kramer talk about this through the work of FSG and collective impact. And the importance of their work is really to help us think about, when we bring together multi-sector partners, it's important to have a shared agenda and a common purpose or vision. We need to think about what data we're looking at and how we access that data to come up with uniform goals and measures. We need to think about how our strategies and our approaches reinforce each other and align with our resources. And there's a greater likelihood when those things are in place that not only will we see coordinated action, but there's a greater likelihood that we could potentially achieve collective impact and sustainable impact over time. And so what I wanted to take you to next is, when I was showing you that table before in terms of engagement, another thing to think about as it relates to engagement are these circles of involvement. So the National Association of City and County Health Officers did a training a few years ago in St. Louis that I went to, and they shared this circles of engagement or circles of involvement slide with us that I thought was really interesting, from the point of view that when you think about the sectors that you want to engage, and then identify the people that you want to engage with, the individuals, it's important for you to think about, how do you want to engage that person, how frequently? And so this circle of engagement allows us to think about not only the outreach and the recruitment, but if we really want to think about maintaining or retaining folks, we need to think about where we're engaging them. So there are multiple circles of involvement, from the core circle out to the circle of possibility. And basically what this slide is telling us is that the core circle is the typical group of people that come together, those 8 to 10 people that come together who you can call upon at a moment's notice, who will do whatever needs to happen. This is typically your executive committee, it's your steering committee, it's your leadership council. It's those group of people hopefully providers as well as people from the community, as well as business leaders, as well as other sectors, multi-sector representation that come together frequently to help lead and move the group through its day-to-day functioning. The circle of engagement is the next level of involvement, and I would say those people, I tend to look at them as the folks who may not be available on a weekly basis, but are those folks who will either chair or serve on subcommittees, like a program subcommittee or an evaluation subcommittee or a development or resource development subcommittee. Those folks that you might be able to engage once a month, or if you're lucky, maybe a little bit more often, to be able to help the core circle do the work in terms of doing the work at the core circle. And then outside of the circle of engagement or the circle of champions, those are the folks who typically are the movers and shakers of the community in which you operate or the region in which you operate, who aren't going to be able to come to all of your meetings, but these are folks that you want to keep abreast through either meetings or through other types of relationships or emails or telephone calls, so that they have access to resources, they have access to funding, they have the political will to help move the agenda that you all are interested in promoting through the core circle and the circle of engagement. So those are folks that aren't necessarily going to be able to show up at each of your meetings. And what I would say is, please don't be frustrated if they're not at those meetings, but there's an importance in engaging them through other types of ways, such as I mentioned, through relationships or emails or telephone calls, so that when you do call upon them, they're able to help access resources, the political will to move your agenda. And then there's this circle of information and awareness. These are folks that may come to a meeting once a year, like your annual meeting, but they are part of your email list. They're part of your email blast, your e-newsletters. Groups I work with, these numbers could be anywhere from 100 to 200 to 500 to 750 people that are on regular email newsletters with you, and you're keeping them abreast with the idea that in time, maybe they would move into a circle of champion or a circle of engagement or the core circle. And then the circle of possibility are all those folks out there who you may be thinking about or want to engage in this process. So as you begin to think about who you have currently involved in your multi-sector partnership, you may want to think about where do those individuals fit within those circles. And if everyone is within one circle, you may want to figure out how do you get other people to populate some of the other circles. You also may find that some folks who are in the core circle over time want to move to outer circles, and people in the outer circles may want to move closer into the inner circles. So this is a great exercise for you all to think about in terms of maximizing retention by really intentionally thinking about how you're engaging folks within your work. And so if we go to these are just some definitions that I went through in terms of that last slide. So if we go to the next slide, what I wanted to do is, before we open it up for questions, is just share with you a few learnings from the field. So one thing that we've learned, and this goes back to what Arthur identified before, is that it's important for us to have a shared purpose and a vision. If we're really thinking about multi-sector partnerships, it's important for us to think about and respect the individual agendas and individual missions that each of us bring to the table, and to maintain those. And it's also important for us to think about, so what is the collective vision of the group to move forward? Another area that I think is important for us to think about, especially when we think about multi-sector partners, is what types of principles, what types of guiding principles guide the work of our group. With another coalition we worked with in San Antonio, they decided they wanted to come up with a few principles that related to transparency, to communication. They wanted to make sure that there was a guiding principle around collaboration, and they also had a principle around respect. And so it's important for you to think about what kinds of guiding principles you want to have as a group in terms of how you'll operate day in and day out. A third area is around relationship building and trust building. And that what we've learned is through all of this work is that the outcomes and the impact of our work is important. At the same time, if we want to do this work collectively, we need to think about the relationships we're building and the trust that we're building, both among providers and among the community. Someone earlier identified the issue of competition, and I would say a lot of times this is a real impediment to the work of partnership. And so part of what we need to recognize is what is the value and what can each of the groups do to move forward an agenda, but how do we come together collectively to do something we can't do either as individuals or agencies uniquely. And so part of this work is about trust building and relationship building. We also need to think about readiness and capacity. Do we have the capacity to think about this work? Do we have the leadership skills to think about partnership development? When we think about this, we also need to think about, are we holding each other accountable to this work? Are we communicating effectively internally and externally to do this work? Another big area that people tend to forget about is recognition. It's important to recognize both individuals and agencies as we think about this work, both in terms of coalition work and the work that we're doing day to day to carry out the work of the coalition and the partnership. We also need to be very mindful about articulating our outcomes and the impact of our work. Oftentimes we think we're doing good work and people will know about that. Oftentimes what I find in communities, people aren't aware of all the good work that's happening. And so we need to articulate outcomes and impact. We also need to think about resources for staffing and infrastructure support. Oftentimes I find there aren't federal dollars or private dollars to support this work, or it's little dollars. So the challenge is finding the resources to support the infrastructure and the dedicated staffing to do this work. And then finally, there's an importance in thinking about a time for reflection to look at what's been working well and what has been challenging and how might we overcome those challenges. So with that, I wanted to open it up to you all to kind of ask questions, and maybe what we'll do is Daisy and I will have a conversation with you about building these multi-sector partnerships.
This would also help us to know where you're at in this process, whether thinking about engaging multi-sector partners or having some challenges around doing that, or any other questions that you may have about moving your agenda forward. So we'll give you a chance to think about that.
I'm wondering if you and I start, Daisy, with some questions, and then let's see what type of questions that we generate with the audience as well. Please, again, feel free to ask us questions. We're more than happy to talk through some of these important issues.
Absolutely. You know, one thing I was thinking about when we were looking at the level of engagement depending on who is at the table, I think one thing that resonated for me is being very clear about your outcomes for that meeting and what you hope to get through, because if you have some very, everyone's busy, but if you have folks that are really some, you know, thought leaders in a particular, you know, topic that you need, and they only have very limited time, so it's important for us to think about, well, what do we want to get done at this meeting, at this retreat? Are we clear about it, and are we keeping the train moving? When I was in Austin, Texas, facilitating a session, And mind you, there was an executive team that kept the conversation going in between these longer meetings. So they already had a plan. They already had next steps that they were going to be on the same page about. What are the questions? What do we need to clarify? And as someone who was an outsider coming in, I really was just helping them drive through, and they already knew where they needed to go. So it actually made it very easy. This was, I think, the third year as a city that they've been coming together with all those multi-sector partners. And I find that my group really was open, and they knew what was expected of them, that we can sit here and talk about these things for many hours, but they were so used to getting to action. So that's what they were really focused on. So if this is the plan, to walk out with some action steps and who's going to do what and table things that maybe don't have funding, that's exactly what we did. So in a 7-hour day, we got done what maybe typically takes months and months of work. And it was evident in them knowing what's expected of them, and what, as a group and also individually, which was really awesome to see. It's a very well-oiled machine, I would say.
Mm-hmm.
So,
well, I think you're identifying something that I think is really important from the very beginning. I think if people are coming together to address an issue or to create kind of some situation in their community, they've got to be clear about what it is they're interested in doing. I would say the first thing you want to do is to kind of begin getting a lay of the land to figure out, is anyone else doing this in your community, first of all, and what kind of history and experience they have. If someone else is doing this, how do you figure out how to connect with them? If someone's not doing this, how do you then begin thinking about doing some outreach with folks to figure out what is it that we want to do collectively, and to be very clear and transparent about what your vision is, what your expectations are. And your initial vision may not be the vision that you have, 5 months down the road, based on who you bring to the table. Similar to that experience or that example I shared in Vermont, where those elders were interested in maintaining that particular situation, and over time, as they brought others on board, that vision and that set of goals and objectives changed. Thank goodness they were flexible enough to do this, because in the end they got something better than what they had initially. But I think you're right. There's a key to begin thinking about what the expectations are of the group, and to really be thinking about that.
And in that Vermont group, which, there was an initial need or question that came up in terms of these elders being displaced, and that's really what brought all these different individuals to the table. So just thinking about, what is that question that you have, and how are you bringing each other together, remaining flexible that multiple partners will have different ways that they access that particular issue or challenge. So leaving that also open.
Exactly. There were a few comments from before in terms of the challenges that I wanted to talk about. In terms of, there was a question of, what's in it for business? And I would actually extend that question out to, what's in it for anyone that you're asking to participate in this work? Just because someone is part of a movement doesn't necessarily mean that they're interested in staying in that. So it's important for us to consciously be thinking about, every time that we're asking someone or doing outreach or interested in recruiting someone to our work, we need to be thinking about, why are we recruiting them and what's in it for him or her. And typically I find businesses are not interested in participating in the work that we're doing in terms of public health. One, because we're not clear about what it is we're doing. Two, is that it tends to be too public health focused. Three, it may be ambiguous. And four, usually it's time intensive. And so we really need to think about, if we're engaging these multi-sector partners, what's in it for them and what might resonate with them. There's another question that came up in terms of, what's the role of the backbone organization in keeping partners focused on shared vision and goals? That's a great question, Barbara. And in fact, to me, I think when we begin thinking about this work, to me, that is the role of the backbone organization. what I'm thinking about here is, first of all, if you're fortunate enough to have a backbone organization, many communities, this is falling upon one of the partners at the table, and there isn't necessarily those dedicated resources. However, if there are the resources to support the backbone organization, what's really exciting here is those backbone organizations, their very nature for being created is to hopefully have the dedicated staffing to be able to keep the group moving. What I would argue, though, is that the staffing from that group needs to begin thinking about what kinds of leadership capabilities and competencies they have, how do they think about engaging multi-sector partners, and even more importantly, how are they holding multi-sector partners accountable to the work of the group. So that as we think about this, it's really important to have backbone support, not only to keeping the vision alive, but also thinking about achieving the goals through the objectives and the metrics.
Absolutely. And I'd echo that. I mean, I think how backbones are involved will be different depending on the community and the needs, and also just the role of this organization in the community. But you know, ultimately it's to keep the momentum going, and how do we keep the conversation going and the interests from the multiple people involved. And that looks different. It may be, you know, ensuring that people are staying in communication in between meetings, to facilitating dialogue in between, or to keep certain small steps going. I mean, it definitely can run the gamut in terms of what it can look like.
I would agree. Oftentimes I find what happens is that the person who's playing the role of the backbone organization as an individual usually has 2 or 3 other jobs, and this is his or her 4th job, and it's a real challenge. So in the best case scenario, the role of the backbone organization is to have the dedicated staff to kind of move forward with this collective action by bringing this partnership together through a vision and holding folks accountable to the goals and objectives and the metrics they've identified. It's really challenging, and unfortunately there's not a lot of money out there at the federal level or at the national level. I'd say there's probably more happening at the local level in terms of support for backbone organizations. There was another question that came up in terms of determining the size of the coalitions and attendance. So what I would say there is that going back to those circles of involvement, what we typically find is, on average, the core group is somewhere between 8 and 12 people. The next group outside of that, in terms of the circles of engagement, or the group that is involved with the subcommittees, or the task forces, whatever you may call them, we'd probably double that number to about 16 to 25 or 30 people. So on average, that's what we find is both the core circle and then the circles of engagement group. If you have more folks involved, that's wonderful. If you have fewer folks involved and you're doing your work, that's great. What I do find, though, is that I've worked with groups. One group that comes to mind is a group in New York where they had about 8 people or 10 people, and they were kind of exhausted or burnt out. And what I was finding is that that just wasn't enough people to do the work of the multi-sector partners. So we spent quite a bit of time using that stakeholder wheel to begin thinking about who else you needed to engage in this work. And so if you think about it, again, that core circle is somewhere between 6, 8, and 10 people. You would double that number when you're thinking about the circles of engagement and task force or work group selection. And then when you begin to think about the circle of champions, you might think of anywhere from 10 to 15 people who wouldn't participate in the first 2 groups, but these are people you could call on. And actually, we've done exercises with coalitions where we ask people to brainstorm, so who would be that circle of champions, and what would you ask of them? And so if you haven't had a chance to do that, you may want to do that at a future meeting where you just begin to brainstorm who those champions are, knowing that they won't come to meetings, but you could call upon him or her to access resources or to help move forward an agenda item, or they have the political will to help you move forward the vision of the coalition.
I think the other piece to add about who's at the table is, you know, often it's very helpful to have them involved, and them being clear what they're providing to help move this agenda forward. So yes, it's important to have good input and diverse perspectives, but it's really more, this needs to get done, can you do that? And that's why you've been asked to be at the table or at the meeting. So it's not just thinking about what other perspectives, but also they're being asked to come for a reason, and they should know why, so that they're ready to say, yes, we can, or no, we can't. And the we could be funding. It could be another organization that provides a service that may be helpful to the cause. But it's important to be intentional in terms of how to leverage what they do bring to the table. And then there's a question here about, what about involvement of elected officials? It's a really good question. I mean, again, you want to, and anytime you engage elected officials, it's important to know, they want to know, well, what's in it for me? What am I doing? And also, you want to think about how to effectively engage their reputation and kind of their power in whatever you're trying to get done. So you have to also, depending on the level of elected official, either it's a city councilor or town elected official to the mayor, you want to be really strategic about how you engage them in the work. So, you know, I find that some city officials are able to, some of them more than others, are able to be involved on a more ongoing basis depending on what the issue is. For instance, when I worked in Mission Hill and Roxbury with Councilor Mike Ross, the young people in the community identified an issue of there's just too many people in apartments in Mission Hill. It was overcrowded, and it was becoming a safety issue. But for the counselor, it was already a zoning issue and a financial issue that had been on his mind that he wanted to do a bill about. So it ended up being mutually beneficial for him to be involved. One, for meetings we were already facilitating in the community. Two, because it gave him context and more info to give more breadth and power behind his bill. So he was actually involved quite often, whereas there were some other ones that we tapped into them from time to time depending on the level of the ask or the issue that we had at hand. But I think it's always great to have elected officials where you want to have your coalition or your group's name on their tongue so that they're, oh yeah, I know so-and-so, so that when it comes time for you or for them to need something, that relationship is already in place.
I want to echo what you're saying, Daisy. At a minimum, you want to have elected officials as champions. You should know, you should be able to go around the table of your coalition or partnership, and everyone should be able to know who your elected officials are. I'm not suggesting that everyone should have a personal relationship with that elected official, but everyone should know who those elected officials are. And then some leadership in your coalition should have access to his or her office to be able to share with them what it is that your coalition is doing. And I would totally agree with what Daisy's saying. Some elected officials, depending upon the issue, are going to become or be interested in becoming more involved with your coalition if it's something that's near and dear to their heart. What I would also say, though, is that if they don't have the time to attend regularly scheduled meetings of your coalition, don't take that as anything other than he or she is busy. I remember working in Newark, New Jersey years ago, and people were upset on a drug-free, a substance abuse prevention coalition that the mayor wasn't involved. And when you think about it, there's a lot going on in terms of a mayor of a large city. So as we began to think about how to engage the mayor, we began to realize that if we could engage the mayor as a champion and see if there was someone on his staff that could be part of the coalition, that would actually be a benefit to us. So again, I think at a minimum, think about elected officials as your champions, and think about local officials, think about state reps, think about U.S. reps, think about your senators, think about who those folks are and how do you engage them as champions. And then in some instances, as Daisy said, and I would agree, those elected officials, city councilors or any of the ones I identify, may be interested in getting involved in your particular issue because it's something that's near and dear to them.
And don't underestimate their liaisons or, you know, kind of their connectors in their offices. I find that they're also very valuable and informed on issues. They're not replacements for, but when you have some elected officials that are in multiple places at once, you know, when Mayor Menino was in office, he used to send his rep to our meetings, and it was just as valuable as having him in the room, and at least having they were also pulled in many directions, having them in the room and saying this is what the mayor can do or can't do, and we'll make sure to get him at the next meeting. So we can't take them for granted. They're also our allies, and again, it's great, you know, again, like Steve said, we don't need to be in deep relationships with our elected officials, but I think knowing who those liaisons are is very helpful for many different reasons.
I want to go back to the question about what's in it for business, because I think typically in our work, my experience both in running a coalition but also in providing technical assistance to coalitions is we tend to think of business as the place we go and ask for money or to make a donation to an event we're doing. And while that's a perfectly appropriate way to access or engage businesses, I think it's also important for us to think about, so why would we want to engage businesses in our work? And I think part of the thinking is that you need to think about why do you want them there? And really going back to the question that was asked by someone in terms of what's in it for them. So depending upon what the issue is, you need to think about, so why would the business community be interested in engaging in this process with you all? I also think it's important for businesses to think about, they typically look at, so what's the return on investment or what's the outcome and how quickly are we going to get there? So if we think about our work, we need to think about not only process measures, but we need to think about what is it that we're doing and how are we going to achieve what it is we need to achieve. I typically find there's a tension between business-oriented folks who are looking for outcomes right now and folks who are in the health and human service provider field that are focused on the process side. And oftentimes there tends to be a disconnect. So as we think about this work, we not only need to be thinking about kind of the process and paying attention to the process, we need to think about the product or the outcomes and the level of impact that we are interested in achieving. Other questions?
So if any questions come to mind, please let us know as we go along or even after.
Do you have any questions, Steve? What's the biggest learning you've had?
Well, we just finished talking about businesses, and I even think of businesses even in their own little circles of influence and hemisphere. I mean, depending on the level of business that they are. But I remember my community work in Mission Hill. There was a local donut shop who we engage in our Crime Watch meetings, one because they're community folks as well, but also it just, they're part of the community as well. They had elected officials come into their office, so it was very helpful for them to be at our meetings and also be seen as this big, you know, individual involved. So even when it comes to transactional relationships, you know, there's even the local watering hole, for lack of a better term. There's a restaurant/bar in my community who we engaged over 12 years ago when I worked at the school next door, and asked them to display the works of young people on their wall, because our young people did, certain paintings and things like that. So of course they said yes, but that brought more business to them by having one local youth work represented on the walls, but they had this different audience attend their establishment because they had their constituents, aka the young people, represented. So, we want to think creatively about how to engage and honor our businesses, and not assume that, and also not assume that they don't want to be involved, but also, I think, in the nicest way, highly encourage them to be involved, because it's very, they also owe us something for being part of the community as well. So we see some questions here that have come in terms of, and I'll read it out. Thank you, Cynthia. What are some ideas regarding ensuring that impact is being measured in the same way by every partner? That's a really good question. Is it necessary to have the same measuring tools for all involved? That's a very multi-layered question. And then I'll read the next one up also. Any thoughts on a small organization dependent on volunteers who may run out of gas or lose interest over time? Woo, those are big ones.
I'd say for the first one, in terms of what are some ideas regarding ensuring that impact is being measured in the same way, absolutely. I think we all need to be thinking about what those questions are. And one way to think about this is to kind of ask yourself, so what are the research questions we're interested in answering? So part of the thinking around this, and these are great questions, Cynthia. The first one is, so what is it that we're interested in answering? Or what do we want to find out as a result of the work that we're doing? What is this intervention going to do? And I guess start very broadly with what are the one or two broad research questions out there. And I use research not so much in terms of thinking about what type of research, but what types of questions do you want answered as a result of the intervention of the work you're doing? And then as you begin to think about those questions, how might you determine how you answer those? What types of methodologies or what types of evaluation approaches do you want to use? Do you want to use focus groups to figure that out? Do you want to do interviews? Do you want to do some surveys? Do you want to look at some data that's available in your community? Do you want to look at data that's available at the state level over time to look at this information? So one, I think it's important that all the players come together and agree on what those questions are. And then two, I do think it is necessary to have some measuring tools that you're all using and that you're all in agreement about. And so for us, that's kind of the evaluation plan, is to think about what are the questions, what types of tools are you using to answer those questions, who's gathering that data, with what level of frequency, and how are you coming back to share that information, not only with the folks around the table, but the broader community. And oftentimes, what tends to happen is that this either gets overlooked or there isn't enough time to do it. So my experience is it's best to begin thinking about this up front. It's best to begin thinking about what kinds of resources we need, what kinds of resources we have to think about this. And I'm not talking about a whole scientific evaluation piece, but to, at a minimum, identify what the question or questions are, and then what types of approaches you're going to use, what types of tools are you going to use to answer those questions.
And another way to think about that endpoint is, aside from what's the issue that we're trying to address, but what will it look like when our work is done? So, and depending on the vantage point that you are entering through, so I'm a particular partner and I'm contributing to the whole in the following way. What does it look like when my work is done? What is it? So it's great to, one, that you're thinking about it, because oftentimes that this is on the sideline, but it's awesome to engage all partners in that conversation now and have them articulate it. So how do you know that you've been successful at the end of this intervention or work together? And then try to figure out what makes sense in terms of tracking your success.
What I like about what you're saying, Daisy, is when you ask that question up front, you're actually engaging everyone in the conversation about what does success look like. And if you've got multi-sectors at the table, the question is, are people answering that question similarly, differently, and where's the overlap? Typically what I find is that sometimes the providers have a certain way of thinking about answering the question. The community may have another way. And so you're going to have to find that common ground. In the best case scenarios, the providers and community members are on the same page about what they want to see as it relates to success. And so as you begin to think about this work, in the same way you've articulated a vision, you can also articulate what success looks like and have a conversation around that, and then begin to ask yourself the questions, and then what types of tools do we need and methodologies to actually answer those questions.
Absolutely. And I think this connects to Arthur's question about, thoughts on small organization involvement when volunteers who may run out of time or interest or even access in terms of funds or getting to things. Again, I mean, hopefully volunteers are engaging for a particular goal in mind. Yes, on occasion you have some that volunteer just to volunteer, but what do they hope to accomplish when their work is done? So again, I think vision and purpose is always the unifying piece here, and I think that third bullet there on relationship building, the more we build relationship and really come back to the question at hand, the issue you're trying to resolve. I assume if you have volunteers, perhaps they're coming to you to help address a particular issue or because they believe in your overall cause. So really going back to that, and also the relationship piece is, I think, what really helps keep people there, right? So you're building that rapport, and you're building, and I think also resonating with lack of time and access to resources, and that may be an issue. So again, we can think about our local organizations and businesses, bringing that back up again. How do we, I brought up that local donut shop that, people just got really delicious, unhealthy donuts, and that's how they thought of there. But when we thought about, well, it's hard for us to fund these meetings in general because they're coming out of mission. So, we'll talk to them about, putting something healthier together, because that was a big part of it. And donating it to the meeting, and they're like, okay, we've been as a business, a way to give back and participate, and how awesome it was that it was service and either location or there. I mean, it makes it a little
A simple kind of mathematical equation that we shared before. It's recruitment plus engagement equals retention. So if you do a good job doing the outreach and recruitment, and you do a real good job in thinking about how to actually engage folks on their terms, there's a greater likelihood of retention. And so building on what you were talking about, Daisy, when we think about engagement, we really need to be asking those volunteers, what is it that they want to do? What do they get excited about? What are they passionate about? And to continually be asking them that question. Because what I find is we have volunteers here in this organization as well, is over time some people lose interest, and that's okay. So then we've got to go out and find other individuals who are interested in doing that work. Sometimes volunteers may have another interest, and we've got to find if there's another place for them to fit within the organization. So as we begin to think about this, what's critical is that we need to be thinking about what is it that engages volunteers, and why would they want to stay involved. And it's also okay to realize that when we think about those core circles, that someone who was an active volunteer for years may move out of that core circle in time. Those are fluid circles. The idea is that you want to continually be bringing people from the outer fringes of those circles down to the core circle over time.
I mean, and again, the question that I know I'm a little nervous to ask sometimes is, we do want to evaluate with these volunteers, why are they involved, and if it makes sense for them to be involved. at the level that they say they want to, or they say they don't want to. So, you know, sometimes it does take a kind of a reality check in terms of what you're trying to get done and the most important people that need to be at the table, and again, the level of involvement that they engage in. But you also do need to evaluate who's at the table and if it makes sense to continue, especially if they, you know, they're having a hard time to access it. So really good questions. Any others from the audience here as we're coming to a conclusion on engaging multi-sector partners?
There's maybe one final thing I wanted to share, and it's a slide. And maybe this is the last thought that I have that I wanted to share with you all, is that when you think about a real interest in transforming communities, there are kind of four elements that we think about. The critical or the foundation of this work is this idea of partnership or collective action or coalition, however you want to define it, or collaboratives. That group needs to think about its approach. And in today's world, that approach is based on data. And you either think about evidence-based approaches, you think about newly emerging ideas, you think about innovative approaches to the work. But those approaches or those interventions are based on data. You also need to begin articulating ideas of impact. So you need to be thinking about measures and metrics that talk about whether you're successful or not. And from a funder's perspective, it's okay sometimes that you're not successful as long as you have kind of an answer and a reason why you weren't and what you're doing to address that. So not everything's going to work all the time, but you've got to begin demonstrating some impact. And then most importantly, our work, we've got to think about it from a sustainability point of view. Are we sustaining the work of the group? Are we having sustainable change in terms of policy systems change? Are we able to sustain some programs? Often more challenging to do than the policy work. But when we think about those four elements, partnership, approach, impact, and sustainability, there's a greater likelihood that we're going to move towards community transformation. And what I would put up front is similar to what we found in Vermont with the elders. What you set out initially may not necessarily be what you're doing in the end as it relates to community transformation as you bring other sectors into the conversation. That's something for you all to think about as you set your collective vision and begin thinking about how to engage people authentically in a conversation around collective action and change.
What I hear within that too is, you know, having flexibility in what that vision looks like, but also accountability, so that that doesn't mean that you're changing direction every time the wind blows, you know, so that you can keep people engaged. It is important to have a final vision of where you want to get to, but that the action steps or the day-to-day may look a little different, but ultimately people want to know what is the end goal, and having someone keep you on that train while also maintaining a flexible approach on how you can get there. And I think that will continue the cycle of involvement and buy-in and relationships, again, if you end up starting this circle for something else or with other partners at the table.
Yeah,
so we'll give another call out for questions too, but I do want to bring attention to the last slide. Again, these are a lot of great learnings from the field, and to bring your attention again to our website, HRI Institute. We have actually a couple webinars and in-person trainings that really speak to some of these specific you know, goals or learnings. So some of these are, or I would say a lot of these are very big and a huge undertaking. So if you're interested in learning more about some of these, you can definitely check out our website and see what else is coming up in terms of, you know, thinking about evaluation or readiness, or, you know, how to do the communication and accountability piece, and etc. But this is just the beginning.
I'm also thinking we could share these slides and these tools with each of the participants today, correct?
Absolutely.
So that everything that we've gone through today, we encourage you to utilize these slides, and more importantly, to take some of the tools that we've shared with you and feel free to use them and adapt them. If there are things that you adapt that you really like, feel free to send them back to us. We're always interested in learning how people are using some of the tools that we've developed. So on behalf of myself and the staff, we just want to say thank you so much for your time, and want to wish you all the best as you continue to build your collaborations and move towards collective action and community transformation.
And shortly after we conclude, you should receive a link to the survey, or give you access right to the feedback survey. So we would love to hear your thoughts, comments on today's presentation. And we want to thank you all for your attention on this top of the morning on Monday morning. So congratulations to you all. Now you can begin your day and your week. So thank you all so much, and we hope to hear from you, and also